Hi. Before we start, there was a little change in presenters. Kelly McElrath was unable to attend today, so another Kelly decided to join me today. I'm Kim DiMeolam. I'm the director of the North Haven site of the APT Foundation, and I've been working at the APT Foundation 27 years now. I'm very passionate about talking about overdose and really happy to do this presentation today. So I'm going to let my co-presenter introduce herself.
So my name is Kelly Morgan. I am the Assistant Nursing Director of Methadone Services for the APT Foundation. I've been working for the APT Foundation going on 17 years. I'm also a certified addiction registered nurse, and I've been doing Narcan trainings for patients, patients' families, staff members, other community members for a while. So I'm actually happy to be here and glad that I can do this with Kim today.
So we're going to go through some information for you guys and then do a demonstration. And then we want to open it up for questions. So please jot down your questions as we go. Okay, so these are our objectives for our training today. We're going to start with some statistics of the overdose crisis, define what an overdose is for you guys, identify risk factors that put people in higher incidence of overdose. We want you to be able to recognize the signs and symptoms of an overdose and know how to respond. Kelly's going to go over the SCARE Me acronym of overdose intervention. We're going to talk about Narcan by injection and nasal Narcan and where you guys could obtain Narcan. Hopefully you'll want to at the end of this training. We're going to start with some statistics just to give you an idea of the scope of overdose in the country. Every year we lose as many people due to overdose as were lost in the Vietnam War. Another way of looking at it is on 9/11, 3,000 Americans died. Every 2.5 weeks, that many people are lost to overdose. And those were just the 2018 statistics. They've gone up since then. Overdose rates have risen 6-fold since 1999. We think a lot of the driving factor behind that was in 1996. I don't know if you've heard about it, but OxyContin hit this market, and it was being prescribed in very high amounts. People became addicted to it very quickly. When people couldn't afford those drugs anymore, they started to switch to heroin. And as we talk about heroin and fentanyl through the presentation, you'll understand the dangers of how when people started that switch over because they couldn't afford the OxyContin anymore, why the overdose rates started to rise so much. In 2020, these are the latest statistics I could find, 93,000 people died due to opioid overdose. So the numbers just keep rising every year. I did the math, and that's a little over 254 people a day. You would think that in the United States, that'd be about 5 people per state on average. It really doesn't work out that way. Here in the Northeast, we are hit a lot harder by overdose deaths than in other parts of the country. Also, the Ohio Valley is hit very hard too by the overdose crisis. So it's about 254 people a day, but it's more in around the east part of the country. And the reason is due to the introduction of fentanyl. That's why the rates have gone up so quickly. Fentanyl is throughout the drug supply. It's not just in heroin. It is in press pills. So people think that they are buying Percocet on the street, but they're actually pressing fentanyl into the pills. So the strength of street drugs aren't known. They're finding it in cocaine. They're finding it in marijuana. And part of the reason is drug dealers will add these into the drug supply to purposely make their drugs seem a little bit stronger. Or if you're bagging up drugs and you're at a table, you're not washing up after you've bagged up fentanyl, and then you're bagging up marijuana. So they're finding that little bits of fentanyl are enough to kill someone who is opioid naive or doesn't use opioids. So when these little bits of these drugs get transferred, that's how a lot of these accidental overdoses are happening. So we really want to caution people. And when you talk to people about drugs, remind them that, you know, these are things that are in the drug supply out there. Okay, so here are some of the Connecticut overdose statistics. These range from 2012 to 2020. And I look, that's about at least a fourfold increase in the drug overdoses. And that's when we started to notice fentanyl being added into the drug supply. The next slide breaks these down a little bit more by county. And this is 2019 versus 2020, the different counties in Connecticut. The fourth one over, that set of columns you can see is New Haven County, where we are right now. There was a pretty big spike between 2019 and 2020. Also to the left of it is Middlesex County. We're at the North Haven Clinic. We also draw a lot of clients from that county. There was a huge spike in overdoses. So as you can see, New Haven County has the highest rates in the state. And that's why we're really happy that you guys are attending this. So hopefully you'll get some kits and know how to recognize an overdose. Okay, so we've talked a lot about opioids, but what exactly are they? Most people know heroin. There's also morphine, codeine, methadone, oxycodone, also known as OxyContin, Percocet, fentanyl, there's carfentanil, which is another derivative, and hydromorphone, also known as Dilaudid. So those are the opioids when we're talking about opioid overdose that we're referring to. In addition, there are non-opioids that are also sedatives and can contribute to overdose deaths. And the reason why is because when you add these non-opioids that we're going to discuss with opioids, they make the opioids that much stronger, and it can cause an overdose that much faster. So they potentiate the effects of one another, or they strengthen the effects of one another, making an overdose more likely. And those medications are Valium, Xanax, and Klonopin. Those are benzodiazepines. That's a class of drugs that they're called. Valium is also called diazepam. And Xanax goes by the other name of its generic alazepam. And Klonopin is clonazepam. So you may hear them by those other names. And the other thing that people don't think about that can add to overdose is alcohol, because alcohol can make the opioids work that much faster and make them that much stronger. A lot of times people will use the benzodiazepines, alcohol, and opioids all together, really making a mixture that is just right for an overdose. Okay, so we have natural opioids in our body, and they're called endorphins. And so our body has these receptors. So an opioid fits very well into that receptor site. In an overdose, what happens is we overwhelm those systems. And we're going to say these same things over and over again because we really want these lessons to sink in. So as you can see, the brain on the left, those are the natural endorphins or opioids that we have in our body, and the receptors that are there. When somebody's using opioids that bring to the right side, you can see how the system can easily get overwhelmed. You have so much flooding the brain that the receptors, it's too much for them to handle. And it puts the person into an opioid overdose. And it basically sedates the brain from the front part near our forehead back to our brainstem, the part that controls our breathing. And it shuts that down. Okay, so some of the things that put people at risk for overdose is sometimes loss of tolerance. Someone will go into treatment for a while, come out and they relapse, and they don't realize the strength of the drug that they're using, or they attempt to use the same amount that they did before, So they've lost their tolerance for using drugs. So that puts them at risk. When you mix drugs, like we talked about, that benzodiazepine class, alcohol, opiates, all together can put you at risk. We encourage people not to use alone, because if they go into an overdose, they can't Narcan themselves, even if they have it available. So we always encourage people that if they're going to use, that they use with somebody else there, or let somebody know, so they can give them a phone call in 15 minutes or half an hour just to check on them. People are at risk when they're using street drugs and they're not buying from the same dealer. Sometimes they come across an unknown source, and those drugs can really vary in strength. If somebody is seriously ill, if they have some problems with their liver, sometimes they don't process the drugs the same way. Using too much in a short period of time can also put people at risk. They'll take a pill, think it's not working, take another one, and very quickly the system becomes overwhelmed. The fentanyl and the drug supply is really causing a lot of problems, really fueling this overdose crisis, because there are no standards. It's made illegally. The strengths vary quite widely, even on the street from dealer to dealer. The strength can really be very different in the product that they're selling. So we encourage people that if they're going to use, to at least try and buy from the same dealer.
Okay, so now we're going to get into what is Narcan. Essentially, Narcan is the brand name for the medication naloxone. It is an opioid antidote that blocks the effects of opioids and reverses an overdose. It cannot be used to get a person high. That's actually good information to have. It will not create any type of euphoria for the patient. So giving out Narcan kits and doing these trainings are beneficial, because it's not a medication that we're really highly worried about being diverted or abused. If given to a person who has not taken opioids, it will not have any effect on him or her. I will not have any effect on him or hers. I think they were asking a question. No. Or her, since there is no opioid overdose to reverse. So as stated before, giving Narcan to somebody who is an opiate overdose, it will reverse the effects of the opioid overdose, but it will not reverse the effects of other substances that they may be overdosing on. But it will not hurt them to give them the Narcan. And we'll see it in a few slides later. We'll briefly go over the signs and symptoms of somebody that may be overdosing from other substances other than opiates. And some of those symptoms, they overlap. So especially as Kim had mentioned with the benzodiazepines and alcohol, because they are central nervous system depressants, some of the symptoms of the signs and symptoms of the overdose may look the same. As well as somebody may be going through medical crises, something cardiac, maybe they have issues with fainting, syncope, really low blood sugar. That may also mimic some symptoms of overdose. We're going to go over that in more detail, but again, the Narcan will not hurt the person if they are taking those other substances or going through some kind of medical crisis. How does Narcan work? If a person has taken opioids and is then given Narcan, the opioids will be knocked out of the opiate receptors in the brain. We have a little simulation that I'll show you a few slides over on how essentially the Narcan takes place of the opiate in the receptors of the brain. Narcan can help if opioids are taken with alcohol or other drugs, but an opioid must be present. Again, same conversation. It will not affect the other substances that are in their system, but it's good to know that even if there are small amounts of opiates in this person's system, it is helpful to Narcan them because just taking out even those small amounts of the opiate that's in their system may decrease the risk of depressed breathing and ultimately fatality. The person should begin to breathe more normally, and it will become easier to wake them. It is very important to give help to an overdosing person right away. So I can't stress this enough. And that is really essentially the whole point to Narcan and why we give Narcan to people in the community. It gives us that window of time to get them to some sort of normality when it comes to their breathing before emergency arises. Narcan only takes 3 to 5 minutes to kick in. So even within those few minutes, if we can get them breathing again, it will reduce any risk of brain damage and again, ultimately fatality. It is very important to give help to an overdosing person right away. Brain damage can occur with only a few minutes of an opioid overdose as a result of a lack of oxygen to the brain. Narcan gives concerned helpers a window of opportunity to save a life by providing extra time to call 911 and carry out rescue breathing and first aid until emergency medical help arrives. So it's also good to know with calling 911, it's very essential that we call 911 and get them the additional medical attention because the Narcan does wear off in a time frame of 30 to 90 minutes, which means they can actually go, even though through assessment, they may be looking better and breathing better, they could ultimately go back into overdose again. So here's the little simulation of naloxone reversing an overdose. So simply, as you can see, the opioid sits on the receptor of the brain. The naloxone kind of comes in, essentially just replaces it, kicks it out, essentially reversing the overdose. And again, it's a time period of 30 to 90 minutes. So that's would be essentially why we would make sure that they would follow up with medical attention. Okay, how to know if someone is overdosing. So it can be difficult to tell sometimes the difference between somebody being essentially high versus overdosed. If somebody is high, they may appear semi-alert and oriented, but that doesn't necessarily mean that if somebody is high that they may not be slipping into an overdose. And we'll go over the signs of an overdose, but again, in bold letters, when in doubt, treat as an overdose because it's not going to hurt them. So essentially, if somebody is only high and not overdosing and we Narcan them, they may not like us so much and it may not feel so good, but they're not going to die, right? So they will go into withdrawal and we'll go through symptoms of what that withdrawal would look like and feel like for that person. Very uncomfortable, but not death, okay? So overdose, unable to talk. Now, unable to talk doesn't necessarily mean they're completely mute. Unable to talk, and this is through assessment, could be simply they're having a hard time forming words, slurring their speech, maybe not opening up their mouth enough to even be able to be coherently understood. Body is very limp, pale, and or clammy. Bluish gray color. The bluish gray color is indicative at this point of oxygen deprivation. And a lot of times you're going to see that first through the lips. You see the blue color in the lips. You'll see some blue color maybe in the fingertips and in the fingernails. That's actually indication at this point that they are being deprived of oxygen. So at that point, it is absolutely an emergency situation. Slow, shallow, stop breathing, pulse slow or not there. If you know how to look for a pulse, right, so 2 fingers, we have a radial pulse on our wrist, or you can feel for the pulse on their neck. Normal heart rate is 60 to 100. So if it's something really slow, hard to find, can't find at all, that will be indicative of the fact that things are starting to slow down. Vomiting, loss of consciousness, unresponsiveness. We have what we call the death rattle. So at this point, the person may not even really have the capacity to swallow, cough, clear their throat. So when you hear them breathing, they're ultimately trying to kind of catch their breath, gasp for breath, and you'll kind of hear like a gurgling noise because they're trying to breathe over the fact that they can't even swallow or clear their throat. Fentanyl overdose, very sudden onset. Individuals may have a rigid posture versus slumped posture found in heroin overdose. And that's actually, I'm glad they put that in there, because with fentanyl overdose, it can happen very quickly, specifically if they're using IV or intranasal, and you may not see that kind of slow progression into an overdose. It may be very fast, very quick. Their body may go rigid. You may see some, what we would say, like maybe seizure-like activity with the patient. Sorry, I use the word patient interchangeably, constantly with the person. And there might be like maybe some, as we mentioned before, some foaming at the mouth because they have a hard time swallowing or clearing their secretions. So, and as well, you would see the other things that we named above, but this is a sudden onset, and there may be some rigidity and seizure-like activity with the fentanyl. These are, so these are other drugs and the symptoms that you would see if somebody was overdosing on these particular drugs. Cocaine is a central nervous system stimulant. So what that essentially means is that everything is increasing, right? So heart rate's going up, blood pressure is going up, body temperature is going up, breathing is more rapid. This can cause seizures, stroke, tremors, heart attacks. People may have chest pains, and those that where the benzodiazepines and the alcohol are CNS depressants. So in that case, everything is kind of decreasing, which really mimics as well what the opiates do, because opiates also are a CNS depressant. So as Kim had mentioned, mixing these, it can be very fatal to mix benzodiazepines, alcohol, and opiates, because they're all doing the same thing. They're all working in your body to lower your blood pressure, lower your heart rate, reduce your breathing, reduce your temperature, all which in a matter of a very small window can be fatal. All right, so here's how we respond to an overdose. We use the acronym SCARE ME. I'm going to just briefly go down the letters, and then we will go into a little more detail what each letter stands for. When we get to the M in SCARE ME, we will do a brief presentation on how to draw up the methadone. We have the kits that we give out here, and oh, I'm sorry, the Narcan. How we draw up the Narcan and give the Narcan. So S stands for stimulation, C is call for help, A is airway, R is rescue breathing, E is evaluate, M is the muscular injection. It's the 1 cc of naloxone that you will be giving, and evaluate and support. So what you should do. The first thing is stimulation. I would say you kind of don't go straight for the knuckle rub, but normally in these cases, you would start with something verbal, right? Maybe you're loudly saying their name, or if you don't know who they are, asking them their name and kind of maybe giving them a nice hard shake, or, you know, kind of assessing, can they hear me? Are they going to respond to me? Is this enough to wake them up? If that is not, if they are not responsive to that, we would go to what we call the knuckle rub on the sternum, which is the breastbone in the middle of your chest. If you press down really hard with your knuckles back and forth, it is extremely painful. If for some reason, maybe they have many layers on, a big coat, you can't get to their chest, we also do a knuckle rub under the nose. It's the bridge on top of the mouth under the nose. Again, very, very painful, sensitive spot. If somebody is not responding at all to that painful stimulation, then they are certainly overdosing, or they're at a place where they're not responsive enough, and they're going to need extra attention. Call 911. As mentioned before, we need to call 911 because the Narcan will eventually wear off, and they are going to need additional medical attention. So it says call 911, inform them the person is not breathing and the person may have overdose. What we have down here is somebody in what we call a recovery position. Easiest way to explain that is that if somebody's lying on their back, you would get on essentially get on your knees next to the person. You would take your hand and go for the leg that is further from you, bend it over. The easiest way to pull somebody over who's completely dead weight is to bend the knee, the other hand on the back of their shoulder, and pull them over into a position where they are on their side. As shown in this picture right here, the knee should be bent over. That had support to keep them on their side, as well as the hand positions, as you see, keeps their head in that position with their mouth open, and the other arm will keep them supported there. And that's in the case of, for some reason, you had to leave the person to call 911. You would want to leave them in that position, because essentially it will prevent them from choking if they are on their side and they can't, if they vomit or they can't swallow their secretions. So A is check airway. If not breathing, then perform rescue breathing. In a situation of emergency where somebody's not breathing, we need to do rescue breathing. In the kit, you'll see we do have a barrier that people can use to put over the mouth when doing rescue breathing. I'm sure in times of COVID right now, people maybe not feel so comfortable about doing rescue breathing or getting close to somebody. So we do provide the barrier. If somebody is not breathing, they're going to need rescue breathing, and they're going to need ultimately 911 and medical attention. So if you feel comfortable with rescue breathing, or you've been trained in rescue breathing or CPR, just a quick overview of what it is. You tip the head back with one hand under the neck, the other's pinching the nose, as seen in diagram A. You make a seal over the mouth with your mouth and give 2 slow breaths followed by 1 every 5 seconds. So it's 2 breaths, assess, and then you would continue that until until 911 arrived. Keep going till they breathe on their own or help arrives. And then E, which is the last part of the acronym, evaluate and provide muscular injection, and reevaluate is where we will, and I have here the contents of the Narcan kit.
All right. So this is our Narcan kit. These are what will be available to anybody after they take the training. Do you want to explain?
Yeah. So the Narcan kits now come with 3 vials. Each are 1 milliliter each of the naloxone. They're just, it's a clear liquid. When you drop the medication, you'll see you're going to drop the entire milliliter. We have provided for you intramuscular needles that you will use to drop the medication. It comes with gloves. The mouthpiece, what I was talking about. So the face shield is in here as well. The face shield that goes over the face if you need to rescue breathing. Alcohol swabs if you need to or have the time to clear the area before giving the injection. And each kit comes with 3 vials of the medication and 3 syringes. All right.
All right, so I'm going to do the demonstration because I am not a nurse, just to show you guys how easy this is to do. These syringes, people ask us all the time, why are you giving syringes out to clients and getting these out in the community? Aren't people going to use these to inject drugs with? Well, this is a huge needle. People do not inject drugs with a 22 gauge needle. Okay, so I'm going to try and do this without my hand shaking. I taught my son how to use a Narcan kit before he went to college, and I had him practice this, and I was much better when I did it. And the one thing that I think is important to remember for those of us who are not in the medical field is always remember to take this plastic piece off. I've had staff members like practice to do this. So you have to flip this off, and there's a little gray circle in the middle. So I'm going to uncap the needle, and you can see that that's a good size needle. And I'm going to put it through this little gray center. And you have to be careful that the end of the needle still stays in the liquid. And then, let's see if I can turn it this way. Then you just pull back and I drop everything in this vial. And I did not do a great job at that.
Well, so it's very important to remember as you're drawing up the Narcan, as you're drawing it up, the liquid's going down. So the bevel and the head of the needle should be going down with it because you want to drop everything that's in the vial.
So this vial is now empty and I have the Narcan in here.
I also, if I could just say really quick, a lot of people are always worried about, they watch movies and TV, right? About getting the air bubbles out. Not necessary. It's not going into the vein. It's going into a muscle. If there is some air because you drew up some air, is not going to hurt the person at all.
People worry too that they're going to stab themselves with the needles after they're done. These are retractable needles. We have a little thematic thing for the holiday that's coming up. It's got a hard plastic top. This is a lot harder than going through into somebody's muscle. So the areas where somebody is going to inject this into.
So essentially you want larger muscles. You want to try to get the thigh muscle, which is the front large thigh muscle if you can. The upper arm muscle, which is a deltoid muscle. You can use the gluteus maximus if you have no other choice, but certainly you want a large muscle because you're really gonna put it all the way into the muscle.
Right.
I tell people, don't worry too much about clothes. It may not go through thick clothes, but in an emergency situation, if you can just pull down kind of their pants just enough to see the upper part of the thigh, or just enough to see a part of their upper arm, kind of jab it in there. If you have to go through cloth, you know, you do what you got to do.
Just like with an EpiPen, you go straight through. So this has a hard plastic top. This needle went through pretty easy. I don't know if you can see that that's in there. I'm going to inject the entire amount. When you hit the plunger all the way down, you can feel the needle retract. It makes, so I'm going to inject the whole amount of Narcan. And once I push it all the way down, as you can see, the needle retracts. In the event the needle doesn't retract, and you're out and you found somebody overdosing, if you don't want anybody to get stuck, you can just stick it directly into the ground, or just put it over there. But most of the time, 99% of the time, the needles will retract once you push the plunger all the way down.
Yeah. So the needles we give are their safety needles. You don't have to recap. Just keep pushing it, and
it'll come.
Even
right
if
back.
even if you take it, even if you take the needle out of the person after injecting the Narcan and it's the needle's still up, just keep pushing till you can't push anymore. You'll see it disappear.
Okay. And after you've drawn up one vial of Narcan and injected it, Kelly said it takes how long? 3 to 5 minutes?
Right. So at that point, you want to assess the person to see if the Narcan is working, right? So is there any increase in consciousness, responsiveness? It takes about 3 to 5 minutes. I always tell people, don't just sit there and wait for 3 to 5 minutes. While those 3 to 5 minutes are going by, you should already kind of be drawing up the next one. It comes with 3. You may not need 3. You may need 3. You may need more than 3. But in the meantime, while you're waiting with each assessment, draw up the next syringe.
Okay, I'm going to try and get this back to the presentation. Okay.
So this is what we just talked about and how it's given intramuscular. So last piece is just a recap. Narcan acts within 1 to 5 minutes. If an individual does not respond, give a second dose in 1 minute. Rescue breathing should be done while you wait for the medication to work. It typically wears off, as we said, in 30 to 90 minutes. It is possible to fall back into the overdose state. They will experience immediate withdrawal symptoms. And just to go over that quickly, withdrawal symptoms in this case, the person may be very irritable, start sweating, sneezing, have goosebumps, stomach aches, nausea, vomiting. So you're going to see all that. And again, very uncomfortable, not fun, but better than death. And likely will not be aware that they overdosed.
Okay, these are some of the reasons to have Narcan around. Fentanyl out on the street increases risks of overdose. And the fact that the overdose rates are increasing so quickly, odds are going up that you may come across somebody in an overdose state, or that you may know somebody that is being impacted by the opioid crisis. And this is a way that you could help. You can, encourage others. You can talk to people about this. Information gives us power. I have 2 staff members that carry Narcan. A lot of the APT Foundation staff carries Narcan on them, and they have intervened in overdose situations on the outside. One of them, they had to administer the Narcan. The other one, they stayed with the person because they didn't quite need Narcan. They were in that semi-overdose state. They were still a little bit responsive, but they stayed with them till help arrived, and that person was able to enter treatment the following week. So those are, just stories. These are things that can happen that it's important to have this knowledge. The other thing is a lot of times people have medications in their homes. I encourage you to lock up any kind of medication. Animals or children can get a hold of those medications. Teenagers can be experimenting. Keep medications locked up. But if an animal or a child gets into any kind of opioid medication, you can use Narcan on them. Imagine that you had some cough syrup that had codeine in it and it spilled over and your cat licked it up a little bit. A little bit can overwhelm a small animal. You can use these Narcan kits to save the animal as well, or a small child. Please be mindful too that, seeing something happening, intervening can make a huge difference. Kelly talked about the fact that minutes can mean the difference between, the person surviving and not having brain damage due to lack of oxygen. The other thing is in the kits, there are gloves. Do not touch any kind of drugs that you see out there in the event you come across somebody that's been in an overdose state. You do not want to touch any of the bags that may be around, or any of the packaging the drugs could have been in, because small amounts of these drugs can go through your skin and cause problems. So be careful, don't touch anything that is drug related. You might be, walking, oftentimes, because I know what to look for, I'll be walking outside and I'll see little baggies around, or I'll see little wax folds from heroin around on the street. So just be mindful. So those are some reasons to carry Narcan. We hope that you guys choose to come and get a kit. The next slide is where you can go and get Narcan. They're available here at One Long Wharf to anybody who's attended this training on the 3rd floor. You can come and get your kit. It looks just like the one that we demonstrated. Also, there are pharmacies that have available the nasal Narcan that's just put into the nostril and injected. There is a list of pharmacies on drugfreect.org. If you wanted to get it through a pharmacy, you can also just call the pharmacy and ask if they have Narcan, but we are happy to give kits away. The ones from the pharmacy you have to pay for, so you might want to come and get your kit from One Long Wharf over here. So we'd like to thank you guys for attending and open it up to questions.
Thanks, guys. We do have a few questions in the
things in the chat.
Yep, thank
yeah.
you.
Oh, I'm so sorry. We were so busy presenting and trying to make sure we got all the information. Let's see. What have you 2 found that people want to know most about from doing these trainings? That's a good question.
I think a lot of times, and I think we reiterated this, people always want to know if I use it on somebody, who's not overdosing or they don't have opiates in the system, is it going to hurt them? And as she had mentioned too, using it, people ask, can I use it on a pregnant woman? Can I use it on children? Those kind of things. And the answer is yes.
Absolutely. And you are protected by the Good Samaritan law of using Narcan. Let's see, here's one. Can I get into trouble for administering Narcan? There's that question. No, you cannot. When an ambulance arrives and they find somebody unconscious, Narcan's the first thing they give them. It can't hurt anybody. It's a very safe medication. Does an ambulance always take somebody away if you call 911?
So essentially, depending on the situation and kind of the assessment of the person after receiving the Narcan, the person may be in a state where we have ultimately reversed the overdose and they can get up and walk away, or they can fight not to seek the medical attention, but we will always encourage that piece of it, that they go and receive the medical attention. Sometimes they continue to receive Narcan through drip or intravenously in the hospital, as well as if we've just Narcan, we need to worry about essentially maybe the situation where somebody is Narcaned and now is feeling sick and wants to go use, right? So maybe it's safer that they are being seen in the ED or the hospital, because if they go use and they still have Narcan in their system, they're going to get sick. They're going to get sick and they're still not going to feel well. And then they want to maybe use more than they normally use because they don't want to feel sick. So yes, they can refuse the attention, or we've done such a great job, they can kind of get up and walk away. But we always encourage that they seek the medical attention.
There's a question on here, and I'm not certain about if you can hurt someone by using it. I wasn't certain if the question was, can you hurt them with the needle? And I'm going to let Kelly answer that, if the needle can be harmful to anybody in any way, because she's our nurse.
So obviously, essentially, the answer is yes, you can hurt people with needles. But in this case, if you are in the spots in which I recommended, or we give intramuscular injections into larger muscles. If somebody is tiny and they don't have a lot of arm muscle, in the moment, will you physically hurt them? No. We do have blood vessels in our arm, in our legs. Can somebody bleed a little bit? Yes. But again, I would say in this situation, giving the Narcan and maybe them getting a little bruised or bleeding is ultimately not really a big issue.
Any other questions people have? Do you want us to review anything again?
I have a question.
Okay.
I'm just curious because like sitting here and listening to this, I mean, it didn't take you very long to go over and I thought it was pretty thorough, but like I've been through first aid training before, like for jobs and such. And I'm just curious if you have any insight or opinions on this type of training being included in like a regular first aid training. I feel like it would be really helpful and for all first aid kits to have this type of stuff in it, because you know, even I was working with children, but for examples, like you were saying, I've heard stories about, you know, teachers who their whole class started having seizures because one of the kids was selling marijuana in the class and they all started having seizures, like a terrible situation. They found out that it had fentanyl in it. And so, do you have any opinions or insight as to like why that isn't a thing? And
well, I know that, and I recently just recertified in CPR, that right now during CPR training, it is actually part of the curriculum. They do overdose and Narcan. I mean, it may not be as thorough as today, but definitely it is now a regular part of the curriculum when they do CPR.
okay, cool.
Yeah. Yeah, I think everybody should have Narcan available to them.
Yeah.
I sent my son to college with a Narcan kit.
Yeah, I have one in my car.
Yeah, I have my pocketbook, every place. They're all over.
And I have another question actually too. In the kit, is there any information like on APT so that if you leave this person, like after everything's taken care of, you can give them information on seeking out possible treatment?
So there is a pamphlet in here that actually goes over what we talked about today. And on the front does recognize APT Foundation, and also the website, phone number, and address to One Long Wharf.
Awesome, thank you.
Any other questions?
Question. Yeah, I have a kit that was from 2018. Is something I should get rid of now? It has an expiration date on the bottle. I opened it up just to double check because it's an old kit. Do I hold on to it, get rid of it? What would your recommendation be?
So if it's expired, then it's no good.
Okay.
Yeah, I would go get it replaced with something that's not expired. Is it nasal or is
Yes,
it?
it's the nasal pillows that I'd gotten from the Department of Health, and so they were like even an expired kit's better than no kit. So hold it with you until you don't have it, and so until I get a replacement, I'll hold it.
Yeah, yeah. And that actually was going to be the next thing I was going to say. Keep it until you get the new one, but certainly replace it. I'm not sure the nasal Narcan if it's good for a year. I know the kits that we give out normally have an expiration date of almost a year. So I'm not really sure about.
Yeah, I'll come down to Long Wharf and I'll replace this for sure. Great, thanks.
Other questions? People worry about carrying needles and a prescription medication. We give you a little form with it. It says it's okay. And on the front will be a sticker too that says what it is. So people don't have to worry about carrying this in their pocketbooks or their cars. You can't get in trouble for having this medication either.
Yeah, so essentially there is a label on the kit that shows that it's a prescription, who prescribed it, where you got it from, and what's inside the kit and how much medication's inside the kit, with the expiration date.
I actually have a question.
Mm-hmm.
Is it okay to store the medication in my car? What is the recommended temperature? The maximum?
Probably best if you could keep it in your pocketbook, but
Okay,
Yeah, I mean,
I just wanted to double check.
what's this medication? You always say like cool, dry. You know,
Yeah, it usually has like a minimum and a maximum. I just wanted
Yeah.
to double check that.
Yeah, and that's a good point. Leaving it in the car can get really hot and get really
Yeah.
cold.
Okay, thank you.
but if that's the only place you're comfortable having it, then
No, I just, I know for me, like, sometimes my husband and I will go to like events and sometimes I have to leave like my pocketbook in my car.
yes.
You know, like I know, for instance, like we'll go to a hockey game and bags above a certain dimension aren't allowed to be inside the event. Stuff like that, you know. I was just thinking about situations like that where I'm not allowed to bring my bag
I
inside.
think for a short period of time, that would be
Yeah.
okay.
Yeah, for a few
And then a
hours.
lot of times out when you talked about like a hockey game or you go to a football game and
Mhm.
people are, kind of pre-gaming before they go in
Of
there.
course.
Yeah.
That's exactly in my head. I was like, that's exactly when I should have it. But
Yes,
like, yeah,
absolutely. So it's great. Keep it in the car. I don't think a couple hours will, destroy it.
Yep. Very
If
good.
you're
Thank
really
you.
about it, you can always come to the APT Foundation. We'll replace it.
Very good. Thank you.
Hi, good afternoon. Andressa here. So I just have a little bit of insight. I am opioid community health worker for the city of New Haven. Just Tanya, for your question about the expiration. So the FDA has extended the life of Narcan. So to 36 months versus a 24 months. So if you look at your Narcan, you can still use it up to 1 more year after the expiration date that is written on the box. Of course, you don't feel comfortable, always take APT's advice and they're happy to exchange it. As far as the temperature question for Narcan, Narcan likes to be as comfortable as you are. So if the car is too hot for you, the car is probably too hot for the Narcan also. If you're cold, the Narcan is probably cold and shouldn't be, doesn't need to be refrigerated or anything like that and doesn't do well in cold temperatures. So keep the Narcan as comfortable as you would like to be.
Excellent. Thank you.
Sure.
I know for a while too, there was a Narcan shortage. That might have also been the reason too that they expanded a little bit, how long they're good for. But we fortunately have a good supply at APT, so.
Yeah, I'm not really sure. I think they just found that, yeah, part of the reason was that there was a Narcan shortage. Um, there was another reason, but I just don't want to discuss it publicly for right now.
No other questions?
Hi, it's Linda. How soon will we be able to pick up the Arcan? How soon will we be able to pick it up?
Today.
They're available
Today?
now.
Okay. All right, thank you.
Yeah, I'll
We
drop
received
in,
word right before the training. They're available at the front desk at Long Wharf.
I can drop in APT's website. They have their hours up there. And anytime they're open, you guys can go pick it up.
So are they available at the call center, the front desk where Sharon is?
Mm-hmm.
Okay.
Yes. Okay. We want to thank you guys for attending. I hope if you get a kit, you never have to use it. But I feel better knowing that there are, I don't know how many of you guys are out there today. We can see at least about 7 or 8 of you guys on the screen. We're happy there are that many more people out there in the world right now who can recognize an overdose and hopefully intervene if needed. Thank you for your attention and for attending. Be well.
Thank you.